In this video, I'm going to show you how to make mouth guards and bleaching trays. The first thing to remember is your mouth guard or your bleaching tray will only be as good as the impressions that you took, the pour of those impressions, and the trimming of the models. If you have voids in your pour, if you have voids in your impression, then they won't be good and will not make good mouth guards or bleaching trays. The first thing you have to do after you've trimmed them and they're ready to go is you have to put a hole in the study models. If you're doing bleaching trays, you need a hole in the maxillary and the mandibular cast. And if you're doing a mouth guard, you'll just need a hole in whichever one you're using. You put a hole in these by going into the dental materials lab along the back wall and use the lathe. And the lathe, you'll just place the study model against the lathe and drill a hole in it. I will tell you that to hold on tightly to the model because the lathe does have a lot of pressure, a lot of torque, and it will pull this out of your hand. So once you get the hole made, you're ready to start with your bleaching guards, your bleaching trays, and your mouth guards. Okay, we have two types of material. The .040 is our thinner material, and it's used for bleaching trays. And the .080 is used for mouth guards. These materials are stored in my office or Miss Schuller's office. So when you need these materials, you have to ask one of us to get it for you. If I'm not here, Miss Schuller can get in my office to get the material for you. We want to handle the material with gloved hands because our fingers leave fingerprints on this material. Okay, the first thing we're going to do is place the material. This bleaching tray material. Be sure that the gasket, the gray gasket, is in place. If the gray gasket's not in place, it will not hold the material securely. Also, when you're finished, make sure that the gray gasket stays in place and please don't throw it away. You place the material into the machine. And you tighten the screw down. It doesn't have to be really tight, just tight enough to hold the material in place. Raise and then place your model, and I'm going to do a maxillary, place your model in the center of the vacuum pad. Okay, bring the heating element around and then turn on the heater switch. The material's first placed in the machine, it's going to appear cloudy, but as it heats, it's going to become clear. Now, we want to make sure that we melted enough, so when we melted enough, that it conforms to the teeth we do the vacuum. If you don't melt it enough, it will not conform to the teeth properly. Also, we don't want it to be too melty, because if it's too melted, then you'll get holes and it will sag and it will not work that way as well. So it takes just a few minutes for it to warm up. In the next video, I'm going to show you, we'll do another video and I'll show you how to trim it. Be sure after trimming the bleach guard or the mouth, the bleaching tray or the mouth guard, that you disinfect it before you give it to the patients. Also, the patients will need to be brought back into the clinic for you to insert it. You cannot give it to them, at your house or their place of work or whatever. They must come back in the clinic for an appointment to have the tray seated. Once I lower the vacuum, we're going to let it vacuum for 30 to 60 seconds. The longer, the better. As you can see, it's starting to get clear, and it's starting to melt. So we're going to sag here, and it's coming along. When it comes to mouth guards, like I said, it's patient's preference. However, I feel like the maxillary do tend to stay a little bit better. And also, patients don't use their tongue to wiggle it at night, and it stays in place better. But some patients may want their mouth guards to have a mandibular one, and that's okay. Of course, for bleaching trays, there'll be 2 trays. When we trim them, they'll be trimmed pretty much just the same. So you can see the plastic, the material is starting to sag. You gotta watch it kind of closely. You don't want it to sag too much. You want it to be nice and soft, so when we start the vacuum, it will conform around the teeth. You see how it's starting to sag? Getting pretty close. Okay, now we'll place it. Turn the vacuum on. That was probably not 30 to 60 seconds, but you'll wait 30 to 60 seconds, count it out, or look at the clock on the wall in the second hand. But before you remove it, make sure it's completely cooled. So wait a couple minutes, 5 minutes or so. You can feel if it's cool to the touch, because this material, where it's not cold, it is still soft. And so when you try to pull it off, it will distort the material. So wait till it's completely cooled and remove it from the vacuum pad. Also remember that if you try to pull it off the model too soon, it will cloud as well. So make sure that it's completely cold.